and certainly to try to keep a lid on potential fear and panic. The governor today pointed out that only one person affected by the coronavirus is in the hospital here, and that person has a pre-existing condition. That in spite of the fact that the coronavirus infections continue to grow in number.
This is one of the more complicated situations that we've come across because of the number of interconnections.
It almost sounds like an understatement after Governor Andrew Cuomo spent the day at 3 different news conferences that showed the coronavirus infection spreading among people who spend time closely together.
His wife has also tested positive. His 20-year-old son has also tested positive. His daughter has tested positive, and his neighbor who drove him to the hospital also tested positive.
That was Wednesday morning, talking about the family and a friend of the 50-year-old lawyer who was the second case of coronavirus in New York State. Then the governor met with religious, medical, and political leaders from the infected family's community. Then, late in the afternoon, the governor announced more cases, a total of 11 of the virus officially called COVID-19. A Manhattan woman was diagnosed last week, then the New Rochelle man and his family. A neighbor who'd driven the man to the hospital is also infected, and now another associate of the man and that associate's family have the virus. And as a precaution, this.
The self-quarantine number, about 1,000. About 1,000.
A lot of people quarantined in their homes under order of the state, overseen by the Westchester County Health Commissioner. I asked her how all those people stay fed during a quarantine that can last 2 weeks.
Luckily, most people have family and friends. We would just ask that they not allow them inside. You can certainly leave food at the doorstep and leave.
And she said anyone who doesn't have family or friends who might be able to provide them with food or supplies can just be in contact with Westchester County, which will provide it. It also checks in with people in quarantine to make sure they stay in self-quarantine. They do that via Skype and other ways of communicating with quarantined people when they're expected to be at home.